Welcome to Cura Talks, a podcast by Cura Health that brings you thoughtful conversations with healthcare professionals across Kuwait. From wellness myths to modern medicine, each episode gives you the insight and clarity you need to better understand your health and your choices. In this episode, we're joined by Dr. Nazha, a women's health advocate and obstetrician-gynecologist, to discuss the broader picture of women's health in Kuwait. From early detection and prevention to breaking the silence around reproductive health, this conversation is about knowledge, empowerment, and giving women the confidence to take charge of their health. Dr. Nazha, welcome to the show.
It's a pleasure to be here. Thank you for having me.
So, what do you think are the most pressing issues that you see in your clinic that is not being discussed enough?
I want to talk about women healthcare in general, especially in the Middle East region. I'm not going to specifically talk about Kuwait because I hope we can target more people. But I think in the Middle East, there's a huge taboo on women healthcare, and it's undermined. My late professor, actually, he was the person that pushed me to go into obstetrics. I wanted to be a general surgeon once upon a time. And I remember during my 6th year, he brought up something. He's Irish, and he passed away during my 6th year of medical school. And he told me that if women healthcare or women issues were male issues, they would have been resolved ages ago. And that triggered so much in me. And I was like, that's actually very interesting. And that was the biggest reason why I wanted to do this. Coming back to Kuwait, I graduated from RCSI Bahrain. Coming back to Kuwait, I realized that there was a huge gap in the knowledge, the way you look at your body, and a perception of other people. I think we're more aesthetic in nature as females, and we tend to keep things on the hush-hush rather than actually address them. So I think starting from a very young age, our biggest problem is our menstrual cycle. A lot of us don't know what a menstrual cycle is. We might have been taught, I think all of us have been taught at school at some point. I remember my 5th grade teacher teaching us about menstrual cycle. We were all giggling under the table.
Yeah.
And no one takes it seriously. You know what I mean? So you grow up getting your period and you don't know what to expect. Your period is the milestone and cornerstone of the rest of your life as a female. And your hormones start changing. You start feeling different ways. And most people might condescend the way you feel or undermine your emotions. And if you don't fully understand why you're feeling that way, I think that's the biggest problem we have as females. So I think that's one issue. And then another thing that we overlook is menopause. I think most females are scared from menopause. They think it takes away from their femininity. And a lot of moms don't want to discuss it and try to keep it on the hush-hush as well. And my mom is like that. She doesn't like discussing it, and everyone thinks they're better than it. And I think it's more of a societal pressure, you know what I mean, rather than the actual etiology behind menopause or your menstruation.
You touch on puberty and women's health, let's say. Do you think there's a gap in the conversation or even the education that the adolescents or young girls get in preparation for what's to come? Do you think schools or even at home, are these conversations sufficient?
No, not at all. Yeah, the biggest example to that is if you were menstruating today. Going into the supermarket, you'd actually have to hide your pads.
Yeah.
Like everyone's embarrassed to go to a cashier and show them their pads, and then they're menstruating. And most people now order stuff online to try to avoid that. And I don't know if you remember during COVID, there was a viral video of people, guys picking up stuff from groceries where they were like, oh, what if you get pads sent over? And everyone thinks it's a huge taboo, but people treat periods like it's a disease. Periods is actually the biggest testament to you growing into the female that you want to grow into. It changes so much in you. All the levels of your maturity start to show up. Your personality starts to show up as you get your period. So I think if we stop treating it as a disease and more of it's just your cornerstone, people will start to look at it differently, start to express it differently. So 100%, there's a huge lag at home. As a millennial, there's a huge gap, especially that we got technology later on in life. So we got best of both worlds. But I feel like the younger generation have better access, like social media, femtech, etc. They're getting more access with regards to what a menstruation is. But as a holistic idea of a household or at school, I don't think we're taught as well as we should.
How do you think schools should go about it?
So this is actually one of the things I wanted to actually tackle when I first came back. So you want someone that's younger explaining it to you, a little less of an age gap, someone that's more trendy, someone that's appealing to the younger generation so they don't feel stigmatized or embarrassed when they start talking about their periods. So I think schools should start initiatives of inviting people in, people on social media platforms, people that are more proactive, they have a voice in saying what a menstrual cycle is, I think bringing these people into schools will break the barrier.
Right. I think also when we do have these discussions, they usually split girls and boys, right?
Yes.
And that, I feel like maybe it strengthens that taboo rather than normalizing this conversation that, you know, this is just being human, right?
100%. Like most guys still to this day don't understand what a menstrual cycle is up until they're married, especially in this part of the world. Like, and that's insane. You have to teach them like a lot. As if you're a wife or if you're with someone, you have to teach them the ins and outs of what a menstrual cycle is, what a period is, because it's not just that 1 week of menstruating. Like I have one friend of mine that keeps telling me she's moody 3 weeks of the month and then she has one good week. And that's insane. Like you need to explain that to people. If you need to be like, I have an ovulatory week, I have menstruating, and I might be like PMSing before my period. So that just ruins most of your month. And most people don't understand that. They think we're moody or they think we're just over-exaggerating what we're feeling. So, yeah, I think boys should be involved and men should be involved. Like even in the long run, the fathers, the brothers, husbands, spouses, whatever, partner, they should be involved in your healthcare and decisions and understand what's going on in your body.
So then how do you think cultural perceptions of modesty or, you know, privacy affect this discussion in Kuwait?
Okay, I'm going to tell you a story. In my practice, we see a lot of patients, different nationalities, all over the world, etc. There's a lot of taboo when it comes to getting married very early on, and there's a high expectation of, and even if we are at this day and age, I feel like we're more successful as females. We know what we want. We can go into whatever career path we want, but we're still expected to get married. Like that's an expectation. Like I feel like every single mother is like, okay, it's time to get married and to conceive. And I saw I don't know, like I respect all societies and ideologies and different backgrounds, but I had a patient, 15-year-old, and she was delivering. And it was the saddest thing I've ever seen because she had the body of a child, literal child. She was delivering and she was going to conceive a child and raise that child. So the patient was crying, like throughout her delivery, she was crying. And I thought it was pain initially because labor pains. And there's this huge taboo in our society that we're going to go down the wrong path if we do not get married or if we do not find a certain stable partner. So I thought that was extremely sad because if she was crying throughout her pregnancy, then she's 100% deemed to have postpartum depression.
Right.
And postpartum depression isn't recognized in Kuwait. It is now, thank God, to the new psychiatrist generation. But I feel like it's still a taboo. Like if you tell your parents you're not feeling well after delivering, they'll be like, Adi, like it's fine. It's just your yeah, it's fine. And it's not, you know what I mean? It's not like it's an actual diagnostic tool of being depressed postpartum. And you're more liable if you don't have a supportive partner, supportive family, etc. So this girl was crying throughout her labor. The only thing I could think of is like how it would affect her postpartum. So I feel like there's a huge pressure on that. So that's one aspect. I don't want to talk a lot about obstetrics, so I'm going to talk about the other aspect of my profession. So gynecology, we have a lot of problems that people don't know nor address. With PCOS specifically, so PCOS is extremely huge in Kuwait. Mm-hmm. There's not a lot of data on it because people don't usually seek medical care or want to participate in research. We're trying to change that one doctor at a time, inshallah. But a lot of moms think if you have a daughter that has excess hair, it's genetics. And that to me is insane because you're not supposed to have hair in male pattern distribution. Some people are like, oh, I'm more hair on my stomach or around my breasts. And that's not normal.
That's insane.
That's not normal. I know a lot of people that normalize it thinking it's khalas adi, just I'll undergo laser, it's just going to go away. Well, it will because you're hiding the actual problem. But that's an actual hormonal imbalance. So you have something going on in your hormones that are leading to excess hair because female aren't supposed to be excessively hairy. You can have hair, but it has to be in a female distributive manner as opposed to a male distributive manner. So that's one thing that our society looks at a female in a more aesthetic manner. So we care about how we look and how we feel. So people think excess hair, laser, excess hair, wax it. But that's not the problem. You're not solving the issue. They don't link stuff. And I don't blame like your average person. I feel like we're a lot more educated than what we used to be. But if I wasn't a doctor, I wouldn't link excessive hair to my periods. Like I wouldn't link the two. It doesn't make sense. But it's actually irregular periods and excessive hair. So that too would actually make components of PCOS that people don't know. Like a lot of my patients walk in and like, really, I have PCOS? Like, why? And I'm like, you've missed like multiple periods and you're telling me you're hairy or you can't put off weight. That's also something else. A lot of people gain weight and they don't know why. Like I have a lot of people around me that don't consume as much as I do, but they tend to be on the heavier side. And that with their irregular period just shows you a picture of PCOS. We see it every day. We just don't know it. We're like, oh, سمنانة. تغيرت. But she actually might have an underlying disorder. So that's one thing. And then the last thing I think that in Kuwait, there's a huge, I don't know, like it's a hush-hush under the rug kind of topic is HPV.
Okay.
It's insane that people don't want to get vaccinated or don't understand the vaccine. So Kuwait introduced the HPV vaccination program 3 years ago exactly. And it's for both men and women. And you can start at age of 9 and it can continue to whenever. In Dubai and Saudi, they're trying to implement it into their actual national vaccination campaign. So they have to mandatory throughout your school years to get the HPV vaccine. And people don't understand. Like people think HPV is HIV. And I don't blame them because like very similar acronyms, but they're very different. So HPV, you can actually get HPV, like it leads to oral pharyngeal cancer. So cancer around your mouth. You can get cancer in your cervix. Like there's a lot of etiology that comes along with it. And it's the only vaccine that actually proves to reduce these numbers significantly. There's some countries across the globe that have 0% of cervical cancer secondary to HPV vaccination. So it's insane. It's for free for Kuwaitian, and there's a small fee for non-Kuwaitis in Kuwait specifically. But people can actually go and get vaccinated. It's 3 vaccines. It's super easy. You'll just have normal side effects of a vaccine, يعني شوية numbness, a little bit of pain. But it's so much better for you in the long run. So on that note, I'm going to tell you about a patient. I had a patient, young patient, relatively in her 20s, got married. She came in because she was pregnant and she has a wart. A growing wart. It looks like a cauliflower, for lack of a better description, but it was growing and it was growing on her genital area and she didn't know what it was. Every single visit she would come, it would grow more. She's young. Yani, I think like I'm 10 years her senior. And she didn't know what it was. I was actually reluctant to tell her what it was, because we still come from the same society. I can't be like, oh, you guys need to be tested for viruses. This might be like a sexually transmitted disease. So I was extremely reluctant. The 3rd visit she came in, it was huge. And I had to refer her to a dermatologist at this point because it has to be like, there's certain stuff you can do to freeze it. And then like they do topical stuff for it before we can excise it. So I told her. And she was actually very surprised. And she's like, I felt like something was weird. But I didn't know, because she wouldn't tell her mom. And why would you tell your mom something's growing on you? Yeah. Like, it's not something we're comfortable talking about. Also brings us back to the idea of like us being a modest society. Actually, it might help us in so many different ways, but it actually ruins a lot of our ideas and then delays treatment, delays your approach to the healthcare system and approaching your doctor. And a lot of people are scared because I might be someone's friend or someone's cousin or someone's family member. If a lot of people are like, I don't want to go to this physician. Right. Kuwait is so tiny. So, yeah.
That's insane. My jaw dropped, by the way. I don't know if you realized. I'm like, what?
I know. Okay, so how do you help then women overcome this hesitation or this fear to do regular checkups, to talk more openly?
When I graduated med school, I wanted to change the way people look at healthcare, specifically females in healthcare or females approaching healthcare. So I decided to create my page. On my page, the whole aim of it was to help one patient. That was literally my aim. When I first started the page, I was like, I don't care. If I help one person, I've helped someone across the planet. And that made me feel like I had some sort of responsibility towards making my content more device friendly or like more screen friendly, because like you can have doctors like educating you online and you can have YouTube videos, chat GPTs there, like you can have so many different resources. But for me, if it's from a person or someone that's non-judgmental and then you're very approachable, it's so much easier. So I feel like physicians are trying to like embody this as well. And there's so many studies across centuries. And there's this huge patient-doctor relationship. The more you're friendly, the more you're approachable, you understand the patient, you treat them as a human, the more they tell you stuff. You can see it every single day. Like a patient can tell nothing to a consultant and then come and tell you everything. It's just how you approach them. So the more you're intact with your human side, the more people start talking about their problems.
Do you find the younger generation is more open to that discussion than the older one?
1,000%. 1,000%. I honestly, like, there's a lot that people can say about the Gen Z. Everyone thinks every generation is better than the next. To be honest, they're more in tune with their health. They're more in tune with what's going on in the world. They're more in tune with what kind of problems they may have. They know how to utilize the internet so much better than anyone else. So they know how to correlate different signs and symptoms, diseases, etc. Maybe they'll take it to an extreme sometimes, but they know.
Self-diagnose.
Exactly. A lot of people self-diagnose with cancer very early on. They're like, oh, I have cancer. No, you don't. No, you don't. You can come. So they seek healthcare faster. But if I'm going to talk about a generational gap, if I'm going to talk about my mom's generation, no way.
Yeah.
Like, no way. It's insane. Like, for them to go to a physician, it takes so much power and energy. So that generation, a huge problem for them is after you start conceiving, delivering, the pressures of life, the female body changes a lot. And the male body doesn't evolve as much as the female body. We have different phases as compared to the male body. For postmenopausal women, or people that have conceived a lot, what that does, is you get a lot of problems. So like urinary incontinence, fecal incontinence, uterine prolapse, etc. People don't seek help when they have those symptoms. There's an actual study that was published, and it says that a female would only approach a doctor after having suffered with urinary incontinence for approximately 3 years.
Facts. Seriously.
Yeah, and fecal incontinence, do you want to guess how long it'll take her to go to a physician? 10 years.
You're kidding me.
It's insane. It's insane. So she'll suffer. And it's actually bad, Yani. She'll live with it. It's completely fine with her. She won't seek healthcare. There's actual solutions, and it doesn't have to be surgical. There's like medical solutions. There's Botox injections. There's a lot we can do to reduce these symptoms. But people are afraid. They think خلاص يعني أعيش عمري وعمر غيري. Like, this is bound to happen. You know what I mean? And it's not. Like, there's solutions to everything.
But no one tells us about this.
Exactly.
I feel like the discussion has to start at home.
Exactly.
And before I had kids, I had no idea. So we touched upon involving men in this discussion. How do you think we should go about that? How do you think men should be involved in this conversation around women's health?
Okay, so it starts at a very young age. I think it should start at home with your siblings. It should start at school. And then we progress that to, so in Kuwait, initially in government hospitals, you're not allowed to have your spouse in with you in the clinic or etc. Now we're actually open to that. So in the clinic, your husband can come and discuss stuff with us, ask questions, etc. From an obstetric side, it's very straightforward. I think our biggest problem is when it comes to gynecological issues, especially a young couple been married for 2 years and they still haven't conceived. And there's a lot of questions that causes a lot of, let's say, turf between the couple. You don't know, like, you want to blame people. You know what I mean? Like, especially, I think people are going to hate me for this, but especially in this society, I feel like people want to blame the girl or the female, and you weren't able to conceive. And people don't understand, and there's also a male factor to fertility or like infertility in that specific case. So you see like couple that come to the office, you can tell that there is like chaos at home or there's problems at home. You see like they're trying to see who the problem is. It's like a competition, you know what I mean? And that's extremely unhealthy. So seeing that aspect, when you see it in the clinic, you're like, okay, I can introduce the idea of seeing a therapist. Not a psychiatrist per se, but you can suggest a therapist. Like, do you guys want to talk to a therapist, want to go into therapy? Oh, surprisingly, people are very open to the idea. In the beginning, I was like, should I suggest it? But then when I saw people were extremely receptive, I was like, okay, this is not my mom's generation.
Yeah.
Like, the world has changed. So like, it's nice. And then you can actually see people understand it more, have more questions. And I'm not a therapist. I can't, nor am I a psychiatrist. I can't be a doctor of all. Like, there's no such thing. And I feel like, one doctor, one solution treats everything. That's such a very old way of thinking. And then now if every single physician just focuses on their field, then you're more able to help the patient as a whole. You refer people, you follow up. I think that helps a lot. Yani, just making sure that there's a male element in your decision, because you can't take the burden yourself or take all the burden yourself. You might have hormonal imbalancement, or you have an uterine anomaly, etc. And your uterus you can't conceive, like you can't have a fetus implanted for some sort of reason. But it's nice to have your husband aware of what's going on. You can't just go back home without ما أقدر أحمل. And ليش? You know what I mean? Like, what is the problem? Can we fix the problem? And science has changed. And it's evolved so much. Like, I feel like problems that didn't have a solution ages ago, الحين, like, easy, just come in. Like breast cancer, like my grandma passed away from breast cancer. الحين the rates are so much less because of like you being able to check prior, or like having campaigns, or people are more aware. And you have a lump, you go check it. Like, even if it's a benign thing, but I feel like as females, I know we started noticing, and now you're more aware of different signs and symptoms. So I feel like campaigning for breast cancer has been amazing across the MENA region. I feel like other diseases might be on the rise if there's younger people advocating for that.
And how do you think women can better advocate for themselves in a medical setting?
They should ask questions. They should really ask questions. And a lot of the patients, when they walk in, because أنا كويتية هي كويتية تستحي, and why would I say this? You know what I mean? Like, she's going to judge me. لا, ask questions. Like, this is very confidential. I know a lot of people hear stories of like physicians and breaching confidentiality and like talking about their patients in like settings, zwara, yama, whatever. And they get like, it's horrifying to hear or to listen about, like, you might know the patient. They should know that this is a safe place. Like, I've never spoken to any of my patients to my family members. Like, my mom hates me for this because sometimes her friends come in. Or they'd be like, oh, سلمي على أمك. And I don't.
Yeah.
And I don't. And then my mom calls me 2 days later. She's like, why didn't you tell me she was in the office? I was like, Mama, I can't. And it's beyond her. She's like, بس قالوا سلمي. And I'm like, no, because that will open a conversation and you want to know. يعني احنا, as female, I think we like to know about other people's life. We like the melodrama, what's going on in people's lives. So we tend to ask. So I think you asking questions and making sure that you have a safe environment with your physician, creating a bond. يعني I love it when my patient stops me at avenues or at a coffee shop. دكتورة شلونك? Or like when they send me pictures of their children that I've delivered, it makes me so happy. Like, people think it's annoying. It might be overwhelming at times, but when you can, we try to be a human with our patients.
We touched upon menopause, and I feel like there has to be a discussion about perimenopause. I mean, I know that it could last up to 10 years. Women go through symptoms thinking that this is like normal, like you just cruise by. Tell us more about it. What should people look out for?
So hot flashes is the first thing people notice. And she's extremely warm 90% of the time. She might notice, like, people don't like admitting it. I feel like like when we're pre-menstruation, we don't acknowledge that this is our PMS. Like, people are like, I'm just having a bad day. You know what I mean? Like, I'm not like that. Okay, so I feel like people don't notice that they have a temper, but they become very tempered. So like, they're angry more, or like the smallest things tick them off. Or they're always on edge. But I think something else that people notice is your period starts to be more distant. So let's say you're regular, so it comes every single month. It starts coming like once every 2 months, and then it spaces out even more. Like, you get it once every 6 months. So we diagnose menopause as in a whole year of not bleeding after like a period of you going on and off. That's when we're like, okay, you're menopausal right now. Do you want to do stuff about it? And there's something I saw that's very admirable, especially in Kuwait. Shout out to مستشفى الجهرة. They have a menopause clinic.
Wow.
Yeah. So it's a designated menopause clinic. So women can just go there and talk about menopause, like do BMD, so specific testing for their bone, and start them on hormonal therapy if they want to do that. And then speak about the pros and cons of hormonal therapy. Because some people don't want excessive hormones in their body. They're like, yeah, I'm good. I can take clover, etc. And that's going to reduce the hot flashes that a lot of females witness. And I think that's the biggest complaint they have with regards to menopause.
I've been seeing a lot of women opting for egg freezing. It's interesting because I feel like women, because you were talking about, getting married, and we feel like we have a time limit and we're going to expire, right?
Yeah.
And so women have taken charge of that. Like, I'm not getting married now, but I want to make sure that I can conceive later on. Are you seeing this more often? Is it more often?
I love this so much. And I love it between my non-medic friends. Like when I sit down. So my non-medic friends treat me like a doctor 90% of the time. But that 10% when they treat me like I'm just their friend and they start talking about it. Like most of my friends aren't married. And we're at that age and people are like, do you still have eggs? You know what I mean? So I love that a lot of my friends are proactive with that. So it's very interesting. And then they're going and they're reading about it and then come in and ask questions. They're like, would you do it? Would you not do it? Do you understand the implications of doing it? I'm very pro egg freezing. Even if you're married, freeze them. Like you don't know when you might want to have a second child, and freeze them for different reasons. So after the age of 35, your, let's say, integrity of the eggs start declining. Okay. You have a higher risk of having a child with Down syndrome, even though IVF has played around with a lot of the genes where you can actually mute those genes for Down syndrome and etc. It's nicer to have more viable eggs than have eggs that have been frozen after the age of 35. I'm not saying anyone's senile after 35. I'm just saying it's just better chances of having a healthier child. So even if you're married, that's, let's say, 32, you've already had 3 kids and you think you're done. Khalas, and I think I'm one and done. You can actually save your eggs for later on in life. Let's say in your 40s, you're like, I think I want a daughter or I want a son and I want someone in the household that's young again. You have that option. And I love that people are more educated with regards to this aspect. And I feel like the biggest movement was the millennial generation. I feel like we are the generation where female were actually empowered to work. And خلاص ما في expectation housewife and then like raise your kids. There's expectation of us being extremely independent and us trying to build a name for ourselves and like try to reach the goals that we wanted to see in a partner. I remember seeing a shirt once and I wanted to get it, but I think my mom would kill me. It said, Mama, I'm the doctor you wanted me to marry. And I love that. And I was like, honestly speaking, that is who I am. Like, your mom always wants you to marry the best person on the planet.
Yeah. Doctor, engineer.
Exactly.
Yeah.
Exactly. So I was like, I love the new outlook. I love how females are very empowered now. And there's a lot of females empowering females. Like this movement is going on. Like I feel like before it was like, oh, I envy my colleague when I envy this female for reaching a certain level. At Hinkina, we're like, you go girl, go get it.
I'm going to probe you a little bit though. So pro egg freezing, so that let's say you want to conceive, let's say in your 40s. Do you think if nature intended for you to get pregnant at a certain time in your life, that maybe it might not be the best idea to conceive at 45?
Okay. So this is universal debates. Universal. It's not just here, it's everywhere. For me, I know a lot of, so I'm going to start with a little bit, take it shwaya wara, and then I'll go back. So a lot of people are now reverting to IVF regardless of their fertility status. Like they can be extremely fertile, but they don't want to undergo in the natural process because they want to have twins, for instance. Khalas, I just want a boy and a girl and we're done. Khalas, we're just done.
Yeah.
That's one way of looking at it. That's going beyond nature. So I feel like with regards to conceiving at an older age, that's also not how things were intended to be, quote unquote, but it's also how you wanted to shape your life. So if you have a plan in whatever you want to do in life, I feel like having a plan just sets everything for you. Some things might not work with regards to the plan, but it's nice to fall back on something. Let's say I'm 40 and I still want to conceive. If I can do the natural route, it might happen, but it might not. And I still want that. Like I still want to know that I have a plan B. So that's why I'm pro that idea, because there's a lot of psychological implication that comes with and then not conceiving because your partner wants to conceive and you don't have the ability to conceive. We see that in the clinic a lot. A lot of people think they can marry like twice and thrice and 4 times because the female can't conceive. I'm not saying just do it for that reason, but I feel like if you know that there might be a psychological impact on you because of that, it's nice to have the plan B. Am I saying I haven't delivered a 47-year-old female? No, I have. I have. And like there's a very older generation that still want to conceive and can conceive. So just something to fall back on.
Can the female body cope though? Because I feel like evolutionarily, you were meant to conceive at a particular period in your life because my science is not the best,
That's
but
fine.
I mean, your bone density, the weight that you need to carry, maybe even emotionally, even raising the child, right? The energy that you might have. I feel like that could play a role.
Okay. When I was younger, I used to look at the West a lot. And I used to be like, my mom would be like, oh, they have older parents. I'd be like, oh, older parents? Really? Interesting. As a kid. And I ignored it. As I grew up, I realized in the West, a lot of people, I'm not saying they don't conceive at a younger age, they do. But a lot of people conceive at an older age where they raise their kids completely fine. What's the cardinal difference between the East and the West? Our lifestyle. I know we run such a horrible lifestyle, and at a very young age you're taught to like have عيش دياي, عيش لحم, and like it's such an integral part of our day-to-day and eating habits, and you just get used to it. You get used to like a sedentary lifestyle. You get to eat a certain way, so that affects you in the long run. I have a very strict diet. Most people hate me for that, and I don't do it as in like short period of time just dieting. No, it's my lifestyle. And when people ask me, they're like, Nazha, why do you restrict so much out of diet? I was like, I want good knees in the long run. I want my knees to sustain the life that I want to run. And then with exercise, alhamdulillah, recently in Kuwait, females, with exercise, wow, like the amount of marathons that are hosted for females, the amount of female-only gyms. Like, Anna, 2 weeks ago, my gym sent out a blast saying it's open at 5 a.m. I was the happiest person alive. I'm like, yalla, they changed their working hours. I can go before work. So I feel like getting in charge of your health at a younger age helps you later on in life. Like, that's basic science. Anna, I take care of my body will take care of me.
Right.
And like having a child it's not a disability to your body if you've taken care of your body.
Right.
If you haven't, then 100%. And حتى Anna, as a physician, if you want my opinion, and I look at you, like, I don't mean to shame anyone, but let's say you're 45, you're morbidly obese, barely walking. Anna, for me as an obstetrician, it's a catastrophe, because then I think of all the bad things that can happen secondary to the excessive weight that you're carrying, plus the child that you'll be conceiving, which is plus 10 to 13 kilograms at a healthy weight during your pregnancy.
That's a great segue to my next question. So then what do you feel is the link between lifestyle factors like diet, exercise, sleep, which I don't think we talk enough about, and long-term reproductive health and women's health overall? Okay, let's start with sleep. I think that's the most important thing. People underestimate that you need 68 hours of sleep. Well, Anna, if you want my personal opinion, 7 to 8. And then agreed. Honestly, you need to treat your body in such a nice way for you to see different results, like throughout your day, حتى psychological impact, your day-to-day, how you approach life, how's your outlook to life. So sleeping a good night's sleep, and like a lot of people, I might get hate, resort to melatonin. Right. A lot of people, like a lot of my friends, like, I took 10 milligrams yesterday. I'm like, woo! That's intended for a 5-day use. Like, melatonin is supposed to be used for 5 days. Khalas, and then you're done. That's all it should work for, to fix your sleep. Not as a long-term solution to like help you in your sleep. If you can't go to sleep at night, there's something keeping you up. Mm-hmm. And I feel like in this part of the world, we're very like, let's turn the page. Let's not discuss it. You know what I mean? Like, if you're going through stuff in your day-to-day, you're like, next, and I do just, it'll solve it. It's fine. You know what I mean? And it tends to build up, especially when you're aware. And I feel like our generation, we're more in tune with like stuff that go on social media, people that talk about feelings, people that talk about different implications. So I think starting with sleep. So sleep affects your cortisol level. Cortisol level affects the way you look at yourself, and your face will start rounding. You'll notice more water across your body, etc. So if you start sleeping well, you reduce your cortisol level. So when you do that, you start to notice a lot of your hormones acting in a different way. So cortisol does affect your reproductive hormones directly. Like, there's a direct effect on that. So you start missing your periods, and a lot of people are like, I have a really big exam, I didn't get my period. Yeah, and obviously you wouldn't get your period because you're extremely stressed. Then a lot of people go with a lot of testing. So for instance, I like this a lot, and if people think prolactin is a hormone that you should look at a lot. Well, people, when they get a hormonal profile, they see their prolactin level. I have 5 really close friends. 2 of them have extremely elevated prolactin level.
And they get scared because when you Google elevated prolactin level, it'll tell you have a prolactinoma, which is a mass in your brain that's producing excessive prolactin. What they don't know is prolactin is a stupid hormone. So it's triggered by a lot of stuff. And one of the biggest triggers is actually stress. So when you get stressed, your prolactin goes sky high. And that will actually be implicated on your periods, on the way you look at life. You'll be extremely down, exhausted, etc. So that's the aspect of stress and sleep, etc., on your reproductive health. As for exercise, I think in Kuwait or in general, I'll go with a bigger, broader study. So out of 3 people, let's say if there is males and females, 2 out of those 3 people will actually have a mental disorder, especially anxiety and depression, And females are more likely to be depressive or have anxiety disorder as compared to their counterparts. That being said, it has been proven across ages, every single study in every single world. And if I do a study in Kuwait, it'll resemble the exact same study in Norway. If you exercise, that actually helps a lot with your depression specifically. With anxiety, you can actually speak to someone. And I think people are more proactive with regards to that. And I think exercising helps so much. It guides you. So I read this one time. The more disciplined you are with the gym, the more disciplined you are as a person. So I implemented that in my life. And I noticed that I start planning my whole life around my gym schedule.
True.
And it makes it so much better. Like, I need to accomplish this today, and then the gym is my treat. And you start noticing it on your body. I mean, it's not just aesthetic. You know, I look good when I'm dressed this way, when this dress looks amazing on me because my body looks better when I go to the gym. No, it's even the way you look at yourself, your reflection of yourself. So it starts breaking down the walls in every single female's subconscious. And at the end of the day, I mean, we have a lot of insecurities, a lot of things that we doubt ourselves with. So I think exercising, and then great link to mental health. In return, when you exercise, you actually help yourself become more fertile, because the more body weight you put on, the less fertile you are, because there's different kinds of estrogen in your body. I don't want to bore anyone, but there's estrogen that is in your fat tissue. And the bigger you are, that estrogen is the one that's utilized. And that estrogen is the least potent estrogen of the 3. So your cycle will not be as proper as it should be or as regular as it should be. So I'm very pro people walking and like exercising. And you try to get your heart running throughout the day. I'm not saying join a marathon, will become a triathlete tomorrow, will do high rocks or whatever. And you can do like light exercises. You can do like aerobic exercises. I know Pilates is on the run at Haino. Everyone's doing that. That's something, you're getting your body moving. You're de-stressing as you're doing that. That plays a huge role. As for food, yani, I feel like I'm blowing into a balloon that's popped. I feel like the more I discuss food with people, the less they'll agree for a month. I feel like a lot of people will agree for a month. They'd be like, oh, my period was so much better this month. My craving were so much less. It's because you controlled the sugar throughout the month. Yani your insulin rush, the amount of sugar you consume, that all affects your cravings, your mood. Yani I don't think it needs a genius to tell you when a chocolate affects your mood. It gives you that transient happiness. And then you're like, what did I do? You know what I mean? So like the more you look into the food you eat, I'm not saying restrictive diets. I'm so against that. And if you want to have a cheesecake today, do it. Enjoy it. Like indulge in it. Don't feel guilty about it. But you can't have it every day. You can't enjoy like pasta every single day unless you do it in moderation and fit it into your diet 100%. Because that all affects your menstrual cycle, the way your hormones go about. And it affects PCOS largely. So a lot of the younger girls are on the heavier side. I think the younger generation, the middle school girls, they come with irregular periods and you tell her to lose weight. Drastic change, because all she needs is 5% of her body weight to be lost in order for her period to go back to normal. So I think that all plays a role.
Touching back on the exercise bit, there's a lot of chatter online and so many schools of thought. I wanted to get your opinion on this. So exercise, great, we all know. There is, for women, an amount of excessive, I'm not sure if it's weight training or aerobic training, that actually counter affects or does more damage because of the higher stress levels.
100%. Okay. So this is mostly in people that so it's more cardio. So if you are a marathon runner, for instance, or something that it requires excessive training. So with weightlifting, it's a different story. So if you're an extremely heavy weightlifter, you're more prone to uterine prolapse, even if you haven't delivered, because you're lifting so much more, you're squishing down, and that will actually affect your organs down there. As opposed to running, a lot of people that are marathon runners report less periods or less frequent periods. And that's actually, there's a huge science behind that. There's a huge link between you excessively training and the reduction of your period or reduction of your hormones in general. So there's a huge correlation in that. I think everything in moderation is always the key. And you want to run 100%. You're a marathon runner. I appreciate you. I don't think you should join marathons every month. You know what I mean?
Yeah.
Like, I think just having periods of grace will respect you in your body will just respect you back.
Okay. And what do you think is the role of technology now, shifting away from our last discussion, in preventative care? So women's health apps, do you think it's a tool that women can rely on?
I love femtech. I love it so much. I love it so, and I appreciate it a lot. So as I was coming here, I spoke to one of my friends and I told her, what's an interesting story that you've had at work? And she's like, Nazha, we had a patient once come to the ED, collapsed. We didn't know nothing about her, no surgical history. We don't know if she had a period, what her problem was, etc. She's like, wouldn't it be great if we had access to an app where we can know, like the person in front of us, what they're going through? She's like, Nazha, imagine after we resuscitated her, this patient, she was 9 months pregnant. And she didn't know. She thought she was gaining weight.
You're kidding.
I'm not. I'm not. And there's also, like, I don't know if you're into TikTok a lot, but there's this trainer. She's a fitness trainer. Yeah. She became famous. I'll show you her picture in a bit. But so TikTok saved her life. She's an athlete, like very slim, slender legs, very well built, but she had a huge belly. But the belly wasn't like saggy. She just had protrusion. So everyone's like, I think there's something wrong. Like on the comments, people are very nice in the comments. So people were like, I think there's something wrong. You should get this checked. Your body looks abnormal. She didn't know something was going on with her. So she decides, she went to a doctor, like just a general doctor. They said, you have diastasis recti, which is like the opening of your muscles. And she's like, okay, cool. And I have diastasis recti, whatever. So she started telling people, there's nothing wrong with me. It's diastasis recti. I think she waited like 7 years or something. And then she went to a gynecologist. She actually had a mass, ovarian mass.
No way.
I swear to God. And she didn't know. She runs, she's an athlete, she does stuff. And then this is insane. Like,
how could you be pregnant for 9 months and not?
By the way,
you go through so much.
I know, but a lot of people undermine that. Like, that's not the first story. My first incident with a female, it was while I was a medical student. I was very proactive with the medical team, but I was a medical student, so I was in the shadows. She walked into the hospital, delivered in the parking lot, did not know she was in labor.
Do they not? They don't get regular periods then, so they must.
That's what I keep on saying. I'm like, if people are not used to it and think that's normal, this is why we're here. Like, this is why people like me, people that are advocating for women's health, should be telling people, and 2 months, okay, maybe you did have a period, but for you not to have a period for a prolonged amount of time, healthcare is accessible, I think, to most people across the globe now. It's not as hard as before. They should be able to see stuff online. So technology has changed that. So different applications have changed it. You tracking your period, your ovulatory phase. A lot of people did not know what an ovulation is. I know a lot of people after their period, they're like, I have pain and خلصت my period. Why am I in pain? And it's actually called Mittelschmerz. And it's ovarian pain. It actually has a name. Like, it's well known, discovered ages ago. This is not today. And if people don't know, they're like, I just have pain on the left side. خلصت my period. What is this pain? It's ovulation pain, excuse me. So I feel like now that people are tracking this, it helps a lot. And people know, before, I feel like people didn't know when to conceive. And now I just try.
Any time of
the month. It might just work. Well, it might. The best phase is during your ovulatory phase. But people are now tracking. This is helping so much. You know more about your body.
True.
Yani as a female that's on in a medical field, doesn't have medics around her, and then you know more about what's going on in your body, and you don't undermine it. Like some people get a fever when they're ovulating, and people didn't know. They'd be like, "Ana marida, yani, is there something wrong?" No, that's ovulation. It's completely normal. But I feel like that rise is helping a lot of people. Like you get more in tune with what's going on in your body.
And how do you think the workplace can better support women in that?
Okay. So when I read into this, I was actually intrigued. There's a lot of places across the globe that give you days off to get a pap smear or to get vaccinated. And I thought that was extremely interesting because I've never heard of that. And I've never thought of that, not just heard of it. I think thinking of it is also part of it. I feel like a lot of my patients are like, "Oh, Dictora, and can I get a sick note?" I was here today. So when I read that, I was like, that's extremely interesting because if you actually implement it, then you are more likely to care about your health. Because I feel like a lot of us, I need to go to a dentist. And thank God, there's clinics everywhere and like working around the clock. But let's say, like when I was younger, I wanted to go to the dentist, and the weekend I can't go to Mustalsif if it's closed. You know what I mean? So like you just neglect it, or you'll take a sick day. But why do you need to take a sick day? Like you're actually taking control of your health. So your workplace should support that. And I'm trying to reduce that. I feel like that's a huge campaign that has to be like a nationwide campaign as opposed to in just a specific workplace. Or I feel like private work sectors help a lot with stuff like that. I think you can advocate with regards to it and like explain certain things. Hatten with like hyperemesis, and you're throwing up throughout your pregnancy. And I feel like people should understand that, and it's not nisat and for fun. Like a lot of people undermine, and especially with, like, I remember one of my really good friends. She's like, "Do you think hyperemesis is a real thing?" And I'm like, "Excuse me," and she's like, "No, I feel like it's musalsalat," and I'm like, "What do you mean?" I'm like, "What?" And she's like, "No, I swear, like, on TV, she's like, 'Oh, I can't smell my husband's cologne.'" And I'm like, "No." I'm like, "No, this is extreme." I was like, exactly like, I grew up watching Grey's Anatomy, and people are like, "Oh, her water broke. She's going to deliver right now." And it's not that. It's not like that. Her water can break, and she can deliver like 48 hours later or like a week later. Adi is completely fine, and you can actually push it. And people don't understand that. So I'm like, no, I love that there's a lot of applications. There's a lot of podcasts. There's a lot of people online that talk about it and try to normalize it. I love that we have a better insight into the West. I feel like they're more proactive because they've been doing it for longer, not because they're better. But I feel like that is being reflected on us as well. Yani we're not just taking their eating habits or their lifestyle. We're also taking the way they're thinking or their outlook on your health. And I think that's the most precious thing anyone can own.
So I wanted to ask how you, as a physician, balance between the very human role of being a doctor, empathy, listening, whatnot, and the very medical side. I feel like a lot of women don't believe they're getting heard, even in a medical setting.
100%. Okay. So I think the medical system in general, puts a time limit on each visit, time limit on how much you can give a patient. And then as a physician, you're not just seeing one patient. I know for you, and as a patient, you're the center of your world that day because you had something dramatic happen to you. Whether you were bleeding, you had a mass discovered. To me, you're just a number. You're just another patient I have to round on, another patient I have to look at because there's 6 of you that think they're the center of the world today.
Yeah.
And I don't blame them. And I feel like the more you see stuff in your personal life, the more it humbles you. So as a physician, you tend to think that the white coat gives you a lot of prestige and you think you're above all until life humbles you. And when you get humbled, you start looking at your patients as people. And this is someone's sister, someone's wife, someone's mother, someone's loved one. So you start to look at things differently. I'm not saying I'm perfect. Sometimes it's very stressful and you need to do stuff at a really fast-paced manner. But there are days where you sit down and you try to understand the patient. I really like it. So there are male obstetricians. And it's very sad when a male is actually nicer than a female.
Yeah.
It's actually very sad. Like when you see a physician that's gentler and I'm sitting there, I'm like, Habibti, so how are you today? You know what I mean? It humbles you. You start to see things from a different perspective. So for me, I've I've had this patient. She was going through a very unfortunate event. So she had stillbirth, or fetus died in utero. And she had to deliver the baby because it was later on in her pregnancy. So she had to go through all the pain of normal delivery, but without the happiness of having a child at the end. And labor hurts. No one can tell you that labor does not hurt. There are means to reduce the pain, but it's still painful. But at least you get a gift at the end. You get a child. You get someone that looks like you or resembles your husband or your parents, etc. You get a joy. But delivering a child that's not alive is extremely traumatizing, and it turns your perspective and everything you've believed in into a very different direction. So this patient, I'll never forget her. I walk in 3 days after she was admitted in the hospital. She's crying. She's sobbing. So I walk in and I'm like, oh, what's wrong? And she looks at me and she's stunned. She's like, no one's explaining what's going on. So I sat down and I was just gentle, like a little touch, a little hug, like breaking the boundary. I know a lot of people are like, it's not ethical or it's not professional for you to hug your patient or for you to touch your patient. I don't believe in that.
Yeah.
I honestly don't believe in that. You can see that a hug goes such a long way. Or حتى touching your patient, like just rubbing their shoulder. When you see they're down, it makes such a huge difference. They'll forever remember you. I have the world's hardest name. Like, my name's Nazha. For a patient to like come up to me weeks later, like, Dr. Nazha, I'm like, oh, because like people are like Zaina, or like, they change my name, and I don't blame them. Like, it's not a very common name. And that it's just, you were humane. You acted as a human, and that's who we are at the end of the day. And doctors are more systematic. You're expected to be very robotic. It reduces error 100%. But at the same time, just being in tune with your human side takes you a very long way. And I come from a very supportive family. And I will always have that huge testament to my family. So my aunts always like to bring up that I'm a doctor in family settings or gatherings or etc. I'm a very outgoing person when it comes to my field, but I'm very awkward in family setting. So the minute I walk in, my aunt would be like, oh, she's a doctor. And then like, if anyone has questions, come and ask her. So they actually line up, and like old ladies come and talk to me. Younger girls come and ask questions. And I feel like if you break the bond and break that barrier of me, I'm wearing my scrubs, into you're a patient, khalas, you can talk about anything. Like, one of my patients started talking about star signs with me. And I loved it. And like, it takes a while. And I've heard this saying from one of the older consultants. She says, your patients, in general, a physician's patients tend to resemble the physician. So you attract your patients. So she's like, Nazha, you're starting to attract your kind.
Your hive attracts your tribe, right?
Yeah. So like, it makes a huge difference. So I feel like always remembering, and this could be your mom, whether your sister, whether your family member, and it makes a huge difference on how you treat your patients. And then allowing the patient to discuss things. So I feel like the medical aspect, a lot of people undermine when you're not a physician and you start talking medical to them. So talk nerdy to me, people don't like that. So like, as a physician, a lot of us are like, and you didn't go to med school, and I'm the doctor, and I studied this, and they start undermining certain ideology that you had. Well, I don't blame you. يعني the internet is so deep. Like, you can go into different holes, or you can find yourself with different diagnoses, and it's extremely alarming. So I know like a patient that talks a little bit in scientific terms and they've done their homework. If I tend to like talk about it and address their concerns. So like in the medical field, they teach us something called ICE. So it's ideas, concerns, and then expectations. So that's how we should approach a patient. So if I see a patient talking in medical terminology, I'm like, okay, so what do you know? Okay. And then she feels more comfortable. I give her the platform, and I'm not undermining Mr. Google. And Adi, tell me what you read. If she starts talking about stuff, Dictoria, my mother had breast cancer, and then they say there's a link to uterine cancer. I'm like, okay, let's calm down. What have you been seeing? Like, what have you been noticing? What would make you feel better about it? And they start talking about it. And I feel like us breaking things down into like layman terms, just simpler terminology, and it goes a long way with the receptivity of you and like the physician and the patient. And I think that's what I try to do. It doesn't work a lot of the times. I'm not going to say, alhamdulillah, praise God, and this has been working. Sometimes I'm stressed. And as a physician, I'm stressed. I have like a very full clinic, and I see there's like 14 or 15 patients that need to be seen, and they need my undivided attention. And every case is extremely different. So yeah, a lot of people, I support people that read stuff and come and ask me questions. And I support people that haven't read stuff and then ask me that they want to read stuff and come back. That it goes both ways. You know what I mean? Like the patient has to go and check it out. So you can be like, oh, go and ask another opinion. Or if you want to like look at it online, if you want different sources, there's different pamphlets, especially like across different societies across the globe. There's a lot of pamphlets that teach you stuff that we might not tell the patient. So in the States, I know they give you pamphlets. And let's say you have a diagnosis, they give you a pamphlet. Hatta the physician doesn't have time, you can read it at your own time and at your own pace. And I feel like now people don't like reading a lot. So I think videos help. And someone going on a platform and talking about it. It's really nice. And hatta with delivery, I know there's this movement that I learned from one of my patients. And that people save their placenta.
Oh, yeah.
I didn't know about that. For one of my patients, I didn't want to undermine it. Yani. While I was delivering her child, she's like, Doctora, can I save the placenta? And I'm like, well, what are you going to do with placenta? And I know there's certain tribes in Africa where they eat the placenta, but I didn't think people in Kuwait wanted to save the placenta.
Yeah, they make smoothies out of it.
People are like, pill form.
Also
actually, And I know my mom saved my umbilical cord, but she just saved it for the sake of saving it.
Yeah.
But she's like, no, I usually plant my placenta at home. And I'm like, very interesting. And I didn't know. She taught me like it's a two-way road. And some people get a lot from the internet, some things that I'm not interested in. And I know مثلا a lot of people are like skin to skin. We've been doing skin to skin for a while. And most of the hospitals in Kuwait are skin to skin and I'm breastfeeding friendly. But I love that my patients are very proactive with regards to that. And I want to breastfeed and I want to try it.
Yeah.
I want to do skin to skin. Can my husband do skin to skin? And I'm like, that's so interesting. And you guys are very on top of it. If I think it takes a younger doctor and an informed patient as opposed to older generation, young patient. You know what I mean?
While we're on this topic, I know you didn't want to talk too much about obstetrics, but I feel like, so you can do the ultra natural way, which is, very unmedicated to allow your hormones to play their role. And then you have, and I'm not hating on the medical field, but I think men have been in control of the medical system for a long time, and it's all about safety rather than what's just natural, let's say. And so we're always, sometimes even indirectly, but like pushed to medicate, like, induce labor, do this, take that. And it's all interconnected because it could also, that playing with those hormones could also delay your milk coming in, for example.
Yeah.
What's your take on that?
Okay. So I'm going to tell you something I used to say myself 2 years ago. Fully changed my opinion today. So 2 years ago, I used to be like, my grandma gave birth at home. She has 6 kids. Why do we have to intervene in so many ways? And then one of my mentors was like, how many people lost a child whilst delivering back in the day? So I like numbers. So I went up and I actually looked this up. The amount of people that used to carry children for 9 months and then lose a child during delivery was insane. When we intervene in a delivery or whilst you're pregnant, it's because science has shifted so much. So now I can predict so many things before the baby is even here. Like at the anomaly scan, I can tell you that your baby has a certain disorder. For instance, if your baby has Down syndrome or Patau syndrome or different trisomies that are going on, you can know this very early on and you can actually have the decision of whether to terminate or not. So Down syndrome, we don't terminate in Kuwait, but the other trisomies we do. So let's say you have Patau, which is one of the conditions that are not compatible with life. Some people want to continue the pregnancy, some people want to terminate, and they don't want to conceive and carry for 9 months for the child not to survive. That's one aspect of it. Another thing is having ultrasounds available and readily available, and more people being able to operate with ultrasounds shows you what's wrong. So a long time ago, you could have lost your child in the 2nd trimester, وعادي. And people used to lose their children while going to the bathroom. Now we know if there's placental insufficiency and your placenta cannot carry this child. So what we do, we optimize. So the age of viability, as per textbook guidelines, is a fetus that is beyond 24 weeks or 500 grams in weight. Lower than that, usually they're not viable. They won't be able to live or survive beyond that point. So let's say we have a lady that was diagnosed with placental insufficiency. What we do is we do serial checkups for this lady to ensure and that she can deliver past 24. Obviously, we want her to reach 34 and 36, but in the unlikely event and if she has to deliver prior to that, we've already made sure that this baby would be delivered healthy. Shlon. So we usually give dexamethasone. So dexamethasone is corticosteroids. And what it does, it helps maturation of the fetus's lungs. Because in the womb, the fetus just surviving out of the mom and the mom's supporting everything. When that fetus gets delivered, if you haven't had good antenatal care, your child might not survive secondary to respiratory depression, meaning the baby's lungs will not work. So you will lose that child. So yes, it is a man world, yes, and they dominate most of it. But there are reasons, it's not mumbo jumbo, yalla, let's just terminate, well, let's just end stuff. Bil'aks, it's a very evolving in a field. Well, this is what I told you in the beginning. So my late professor is saying, and we don't have a lot of research, or the probe was designed by a male, or there could be friendlier probes, well, less painful probes to do a transvaginal ultrasound, for instance. This is stuff that's driving in a female in the field to actually do stuff. I'm very pro-research. I love doing research. But it takes a minute for me to convince people. And yalla habibti, you're answering these questions because it'll better your healthcare, the system, how the system looks at you. So there's a lot of implication that can happen antenatally. With regards to induction, I'm talking about guidelines. We don't usually induce before 41 plus 3 weeks as post dates. Okay? Some people might want to get done in 40 weeks خلاص but all the studies have proven up until 41 plus 3 weeks you're good to go. So we induce at that time. Why do we induce? So there's a reason. So if you go past that mark, your child might be lost لأن خلاص he can no longer sustain being in the uterus. And that's what used to happen before, and they would wait for the spontaneous delivery to occur, and then you might not have a viable fetus or a live child. I shouldn't call it a fetus at that point, but a live child. So we do all these interventions to help you have a safer delivery, safer pregnancy. And it just, the relationship between the physician and the patient just changes a lot. And with all the imaging, all the tests that we can do. So I think it's more of the outlook. As with regards to, I think you met analgesia specifically. With regards to the delivery process. A lot of people do push you to undergo analgesics throughout your delivery process. It's multiple reasons. So it's very intimate. Delivery is a very intimate process. As per universal guidelines, you have to get examined multiple times throughout the day before you can actually see your child. Per-vaginal examinations are very disturbing. They're very painful. You have a lot of muscles down there. A lot of people don't know that when you constrict, it's actually very painful for you. And it's been a while that I've been doing per-vaginal examinations. I'm yet to see someone to scream when I do a PV. I'm yet to experience that. And when I walk in, I'm like, Habibti, it's my muscles against yours. If you relax, it won't be painful. And people tend to relax when you tell them that and explain it. Like I usually tend to touch where the muscles are. I'm like, this is a muscle and this is a muscle. You relax, your PV will be easier. So talking to people helps. There's few people that aren't cooperative. So you give them the idea of an epidural, for instance, or nitrous oxide. A lot of people just use the mask, and that helps a lot. With the epidural, we usually reduce the dose. I'm not an anesthesiologist, but they usually reduce dose. Ashan, you can have a safer delivery. You can feel the push. You can feel that. You can have the skin to skin. A lot of people that are undergoing cesarean sections, we don't usually advocate for general anesthesia because we want the skin to skin interaction between you and your child. So I feel like, yes, it did start or get curated by a man in the beginning or male factor, but I feel like females are more proactive now as physicians. I don't think you can mute a female physician anymore. I feel like we're very loud.
No, but I feel even a lot of female physicians will, for example, promote a C-section even when you don't need it.
Okay. This hurts. It actually hurts. Okay. I'm going to be devil's advocate. Okay. So having a planned C-section is not advised unless there's a medical indication for it. Let's say your placenta is not implanted in the right way. You have a big baby. These are indications for a C-section. let's say your placenta is extremely insufficient and your child is not doing well, then you would revert to a C-section. Otherwise, if there's a prolonged labor and she's not dilated a certain amount in a specified amount of periods, they will على طول switch it to a C-section. Why? Because when you go in a private sector, you're paying out of pocket. People don't want to wait. In the government sector, a lot of people complain. And after like 12 hours, she's like, خلاص. And I'm so tired. Like, it's not coming. That's what we're doing is we're following guidelines and we're following international guidelines for you to have very safe delivery. Whereas if you pay the money for a C-section, it's easier for me as a physician. It's easier for you as a patient. Recovery sucks for you. But you're out of my hand. This is what you want. I'm very against it. I love operating. I love operating C-sections specifically. It's very nice as a surgeon. It's neat as a surgeon. Yeah. I hate it for my patients. I absolutely hate it. Because 4 weeks post-op, she comes in complaining and the skin is not as nice. Her scar is not nice. And she used to be extremely athletic with 6-packs or 2-packs or 4-packs or her obliques were showing. And it's gone. She'll never get it back. And she'll never get it back because what we do is we open the muscles. So what happens in a 6-pack, so your rectus abdominis, we open that to get to the uterus. فخلص هذا مع السلامة. It'll never go back unless a plastic surgeon opens you up again and sutures it. Because that's their niche, not ours. Ours is protective measure, you, child. Yeah. And the aesthetics doesn't matter unless the scar. Yes, we do care for that. But I don't like it unless you need it. Unless it's life-threatening for you, for the child, yes. But there's this huge trend of like younger girls wanting a C-section and they don't want to go through the process of delivering. Yeah. I'm not a huge advocate for that. Yeah. No, I'm more of take care of your body the way your body looks because it won't come back.
Let's shift the focus now to women's health and the role, mental health and the role mental health plays in a woman's overall well-being. How do we normalize that conversation in a medical setting?
Okay. So thank God recently there's a lot of mental health therapists, a lot of mental health apps. I joined a competition a while ago and I think out of the 17 projects that were being discussed, of 2/3 were mental health applications. And for me, that was extremely exciting, extremely intriguing. I feel like I've undermined mental health at one point in my life. And I feel like a lot of us have that. And now we undermine people's mental health. And now everyone's going through stuff and it's completely fine. But it's not that. I feel like putting yourself in other people's shoes, as cliche as that sounds, you get a completely different outlook with regards to the healthcare itself. I think before people did not have interdepartmental communication between different physicians. I feel like that's been bridged. I don't want to say completely, there's always room to improve, but that's been bridged. And he's sitting in the clinic. If I notice someone is not okay, I'd be like, do you want to speak to someone? We have the facilities for you to speak to someone. Well, some people are extremely proactive about it. Well, some people aren't proactive about it. Some people are like, no, I'll just pray and like get more in tune with God or like with ad'iyah, etc. and I'll feel better about it. But there's a lot of people that are taking charge of it. And there's a lot of physicians that talk to each other about it. Like as an obstetrician, I do talk to the psychiatrist in the hospital. And in our government hospitals, there's a dedicated psychiatrist for maternal health. So it's very nice for you to notice stuff like that. It's very nice for you to appreciate it and start to notice the differences. 100%. And there's no cure or like definite cure for you to get out of depression, for you to get out of your anxiety disorder. But you can taper it down and tone it down, talk to someone. I feel like as females, we always want someone to talk to. And that's probably 50% of our problems. Yeah. And it just, please listen to me. You know what I mean? So it helps. Hatten as a physician, I can't be your therapist. Like I'm not licensed to do that, but I'm licensed to listen. And I'm licensed to recognize something. And I'm licensed to refer you to someone that can actually help you. So I feel like in Kuwait, it used to be a huge taboo. I feel like now people are more open about it. And I am on SSRIs. I am taking pills to help me with my depression. And it's beautiful to see. And you can see people not being ashamed about it, especially our generation. I think the older generation might still have a taboo, but there is a change, there is a shift, there is a difference. There's people talking about it online, there's people discussing it, and I feel like that's bridging the gap.
What's one myth about women's health that you'd like to bust?
Okay, there's one myth, just one. Okay. Females are the infertile ones. I think that's something that hurts a lot of families. It hurts a lot of people in the society. And a female cannot conceive for 2 years. Haram. ما تقدر تحمل. What if it's a guy? And I think people don't understand. And sperm count does make a difference. People don't understand in a motility, semen, and it all makes a difference. And if your spouse smokes a lot, that does affect his sperm count. And I feel like I want to break that and break that stigma. And Bella, there are two people that are playing in this, and it's not just the female. And I feel like we take most of the burden, and we get very ashamed of not conceiving very fast. So people ask, I feel like in Kuwait, there's something that it's not, I think, appropriate. I think we still haven't reached that level of maturity, and you're not supposed to ask about people's infertility or conception or delay, etc. But I feel like a lot of people have normalized it in this society, and I think if you're going to normalize it. Males can be infertile too.
Thank you for that. Okay, and what's one message then that you'd like to leave with every woman?
So what I want most females to know, or like to think about, set your mind to whatever you want, and then no one can ever stop you. Yani, I feel like across the years, we've proven that we can do whatever we want in terms of our healthcare. You can take charge of what's going on in your body. Don't let anyone tell you what you're feeling. And what you feel is valid. If you're feeling something and all your labs are negative, 100% something's going on. And you should actually pursue it. And don't let someone in a white coat or someone in scrubs tell you what you're feeling is not true. As for yourself, and just try to take care of yourself. And I think a lot of us start neglecting ourselves once we settle into a family. Life just starts going about. I feel like don't lose yourself. And I listened to a podcast a while ago, and it changed a lot in me, and I want that to resonate with people. It's been told that if you go on to an interview, or people ask you in general, new people, new group of people ask you what your hobbies are, you tend to say hobbies that you used to do and the stuff that you no longer do. So I used to introduce myself as a soccer player. I haven't played soccer in 3 years. And I was like, that's actually true. And it's very sad that you start losing yourself. Your day-to-day takes you away from things that you were passionate about, things that used to lead your life, and you thought you were the best at it. And I used to think I was the best soccer player on my team. And I used to win championships, and I haven't done it for a while. So that gave me a step back, and I was like, wait a second, I can't introduce myself like that anymore. And I want to introduce myself in that way. So that shed light on it. And I was like, khalas, we'll go back to playing soccer again if that's something that's really important. And regardless of what your hobby is, just make sure you don't lose that. And then make sure life doesn't take that away, whether you like to draw, whether you like doing your makeup, or you like to read books, and just make sure you just don't lose that, because that actually helps your mental health. That'll reflect a lot on who you are as a person.
That's amazing. You are a gem, by the way. Thank you so much for coming on the show. I was flabbergasted for most of this conversation. The camera wasn't on, but I'm like, but anyway, thank you so much for your time.
Thank you for having me. I enjoyed it.